Welcome to the deep dive. Let's get straight to it. Weight loss.
Yeah.
If you're anything like me, you've probably seen that endless parade of diets, promising amazing results.
Oh, absolutely.
Only to feel, well, frustrated when those quick fixes just don't stick. Are you tired of that whole cycle?
I think a lot of people are nodding along right now. If you're feeling maybe overwhelmed by all the conflicting advice out there, and you're really looking for something that, actually works long term, then yeah, this deep dive is definitely for you.
Good.
We're going to try and cut through some of that confusion, really look at the differences between, say, medical weight loss and those very tempting fad diets.
Exactly. And we've been looking at some really useful stuff. Articles from Twin Lakes Heart Center, Thrive Med Spa and Wellness, Stark MD.
Right, and that MedFit Care podcast intro, too.
Yeah, that gave a good overview. So our mission here is pretty simple. Give you clear, evidence-based info.
So you can make smart choices.
Right. For your own journey. Okay, so let's get into it. When we talk about fad diets, what are the kind of common things our sources were pointing out?
Well, the picture that really emerges is one of these very restrictive eating plans. They always dangle that promise of, like, super rapid weight loss.
It's a quick fix.
Exactly. And what's really eye-opening is how often they just skip over balanced nutrition. They don't really consider your overall well-being at all. Think about things like, I don't know, the lemonade cleanse or the HCG diet or even the Cabbage Soup Diet.
Oh, yeah, I remember that one.
Right. They're just characterized by these rules that are incredibly tough to actually stick with.
And they don't seem very connected to how our bodies, actually function, do they?
Precisely. That's a key point. Thrive Med Spa mentioned these diets can unfortunately lead straight to nutrient deficiencies.
Right.
And they might even pose potential health risks.
Okay.
And what's really interesting is that initial weight loss people see, it's often not even the good kind of weight loss.
But you mean?
Well, it's frequently just water weight, or worse, muscle loss.
Ah, not actual fat.
Exactly. Not the reduction in body fat that's actually beneficial for your long-term health. And, ultimately, all our sources basically agree on this. Fad diets just aren't sustainable. Not for managing weight over time.
Okay, so that's the fad diet picture. Pretty clear. Now let's flip to the other side. Medical weight loss. What are the, fundamental differences right off the bat?
Medical weight loss, and this came through from Twin Lakes and Stark MD especially, it's a completely different strategy.
Okay.
It's fundamentally rooted in doctor supervision. So you're guided by healthcare professionals.
Right, actual medical oversight.
Yes. And the real key, I think, is the personalized approach. It carefully considers your individual health profile.
So things like?
Things like your unique metabolism, your specific lifestyle, any pre-existing medical conditions you might have. It looks at all of that.
So it's definitely not just some generic diet sheet they hand you and say good luck.
Not at all. Not even close. And the main goal isn't just about seeing a quick drop on the scale either.
Right.
Instead, the central aim of medical weight loss is helping you achieve, meaningful and lasting weight loss.
Okay.
While at the same time working towards improving your overall health.
So it's health focused first.
Absolutely. It's an approach built on science-backed strategies designed to give you results that are both sustainable and, really importantly, realistic for you.
That makes a whole lot more sense. And when you think about the bigger health picture, especially here in the U.S., the statistics really show why we need a better approach.
They really do.
Thrive Med Spa mentions some pretty significant NIH data. Like over a third of men and more than a quarter of women overweight.
Yes, it's quite high. And if you connect that to the broader health implications, well, carrying excess weight isn't just about how you look.
No, definitely not.
It significantly bumps up the risk for serious conditions. Heart disease, type 2 diabetes, high blood pressure.
Joint problems too, right?
Joint problems, exactly. All sorts of things.
Which really hammers home the point that, prioritizing health isn't just about fitting into smaller clothes. It's about real improvements, physically and mentally.
Absolutely. Thrive Med Spa highlighted this well. By focusing on your health, you can actually lower your risk of those conditions. You can experience a better quality of life overall, have more energy.
Boosted confidence, maybe?
Yeah, boosted self-confidence, a more positive relationship with your body. It's all interconnected.
And this seems to be where those fad diets really miss the mark, doesn't it?
Yeah.
Because they tend to be these very standard, like one-size-fits-all plans.
That's a really crucial point. Fad diets often fail precisely because they don't take into account those individual differences.
Your specific needs or preferences.
Exactly.
Yeah.
Or any underlying medical conditions you might have. What works for one person might be totally ineffective or maybe even harmful for someone else.
Okay, so let's really let's dig into those key distinctions then. We've touched on it, but let's spell them out. Medical weight loss versus fad diets. The first big one seems to be long-term results versus just like a temporary Band-Aid.
Exactly. Medical weight loss programs, and this was consistent across the sources, are fundamentally about creating lasting lifestyle changes.
Sustainable ones.
Sustainable ones, yes. The goal is results that stick around for the long haul, not just a quick change on the scale that vanishes.
Which is the opposite of fad diets.
Completely. Fad diets, even if they cause that rapid initial drop, are just notorious for high rates of weight regain.
How high are we talking?
It's pretty striking, actually. Some studies suggest up to 80% of weight lost on a fad diet can come back within just a year.
Wow. 80%. That really shows how unsustainable they are.
It really does. It highlights the core problem.
Okay. Another key difference seems to be the whole methodology, like an evidence-based approach versus, well, sometimes it feels like just gimmicks or trends.
Yes, absolutely. Medical weight loss is firmly rooted in scientifically proven strategies.
Clinical proof?
Clinical proof and the clinical judgment of healthcare professionals.
Yeah.
It's a world away from the often unsubstantiated claims and, frankly, pseudoscience you often see with fad diets.
Right. And it sounds like it's not just that you lose weight, but how you lose it. Focusing on creating lasting habits rather than just these short-term, sometimes extreme goals.
Precisely. Medical programs put a really strong emphasis on developing healthy eating patterns, integrating regular physical activity that works for you.
Managing stress, too.
Managing stress effectively, yes, and making those behavioral shifts related to food and lifestyle. The aim is to cultivate a way of living that supports long-term weight management.
Whereas fad diets are just about that quick number.
Yeah, they tend to be intensely focused on hitting rapid short-term weight loss goals, often using methods that are not only extreme but basically impossible to keep up.
It also sounds like you get a lot more actual support with medical weight loss compared to trying to, figure out a fad diet all by yourself.
That's a huge advantage, definitely. Medical weight loss offers ongoing support from a whole team.
Like who?
It could include registered dietitians, medical doctors, maybe even therapists or psychologists.
Okay.
They provide continuous monitoring of how you're doing, essential education about nutrition and habits, and really crucial guidance to help you navigate the challenges, because there are always challenges.
Of course.
And you just don't get that kind of comprehensive support when you're doing a DIY fad diet from a magazine or something.
No, you're definitely on your own there. And you mentioned earlier, the focus isn't solely on the number on the scale in medical weight loss. There's more emphasis on what that weight is. Like muscle versus fat.
Absolutely. That's a critical distinction. Medical programs prioritize changes in your actual body composition.
Okay.
The main goal is losing body fat while actively working to preserve your lean muscle mass.
And why is muscle so important?
Well, lean muscle is metabolically active. It plays a key role in keeping your metabolism healthy and burning calories efficiently.
Got it.
So they often use tools like body composition analysis to track this progress in a much more detailed way than just looking at total weight.
Unlike fad diets, which just focus on that scale number.
Right. Fad diets typically focus almost exclusively on that number, often with zero regard for whether the loss is fat, muscle, or just water.
And finally, it sounds like medical weight loss takes a much more kind of holistic view of your overall health situation.
Precisely. Medical weight loss involves really thorough health assessments right from the start.
To find underlying issues.
Exactly. To identify any underlying medical conditions or other factors that might be impacting your weight. It's a truly holistic approach that goes way beyond just counting calories or cutting out food groups. They're looking at the whole picture.
Okay, so medical weight loss definitely sounds much more comprehensive, more sustainable. What are the actual, pieces of these programs? What can someone expect if they explore this?
Well, as the sources detailed, these programs are designed to be highly personalized.
Tailored to you.
Tailored specifically to your unique biology, your personal goals, and your lifestyle. A real cornerstone is nutrition counseling.
Okay.
You work closely with professionals like dietitians to develop customized meal plans that promote sustainable, healthy eating habits. Moving away from those really rigid, often unrealistic cookie-cutter diets.
That personalization element really does sound like the key to making it stick long term.
It's absolutely crucial. And then, in addition to that personalized nutrition guidance, providers might sometimes recommend FDA-approved medications for weight loss.
Ah, yeah.
Now, these would only be prescribed after a really thorough assessment of your health profile,
Sure.
but they can be helpful in different ways, maybe suppressing appetite, helping regulate metabolism, or managing cravings.
Were there examples mentioned?
Yeah, the sources mention semaglutide, you might know it as Ozempic or Wegovy, and also tirzepatide, which is Mounjaro.
Okay, so it's not just diet and exercise advice then. Medication can be part of the toolkit if it's right for the person.
Yes, exactly. For certain individuals, medication can be a really valuable and effective tool within that comprehensive plan.
Makes sense.
And furthermore, behavioral counseling is often a big component too.
To deal with the mental side.
Precisely. To address the often significant emotional and psychological factors tied up with eating habits and your whole mindset around food.
Yeah.
As Twin Lakes Heart Center rightly pointed out, achieving and keeping a healthy weight is just as much about your mental and emotional approach as it is about the food itself.
That really resonates. That mental piece is so often just ignored in typical dieting advice.
Exactly. And some programs also bring in metabolic testing.
What does that do?
It helps get a better handle on your individual metabolic rate, basically, how your body burns calories when it's resting.
Okay.
And knowing that allows the team to further fine-tune your plan, optimize it for your body's specific needs.
Sounds very detailed.
It is. And crucially, it all involves ongoing, supervised progress, regular check-ins, consistent expert support.
Accountability.
Accountability, yeah. And it ensures you stay on track. It allows for adjustments if needed. And the number one priority always is that health-first focus, making sure the weight loss journey is actually improving your overall well-being.
So thinking about all these components, who is this really for? Who would be a particularly good candidate to look into a medical weight loss program?
Our sources give some pretty clear indicators for that. Definitely individuals who've tried, various traditional diets and exercise plans again and again without getting sustainable results.
The ones who feel stuck.
Exactly. Or those who find themselves in that frustrating yo-yo cycle, losing weight only to regain it after they stop the diet.
Right.
Also, people who have underlying health conditions where weight management is really important. Things like insulin resistance, high blood pressure, other metabolic disorders.
Where weight loss could significantly help their health.
Yes, it could have a major positive impact. And finally, really, anyone who feels they need a more structured, physician-guided plan.
Someone who wants that ongoing support and medical expertise.
Exactly. They'd likely find medical weight loss a much more effective and supportive path for them.
It really does sound like it's geared towards people looking for a more maybe serious and comprehensively supported way to improve their health. Now, one point Stark MD really emphasized was the importance of a holistic approach. Can you expand on that a bit?
Absolutely. They highlighted that weight gain isn't just a simple math problem of calories in versus calories out.
Right. We know it's more complex.
It's way more complex. There's this intricate interplay of factors, your hormones, your individual metabolism, even things like your stress levels. They all play significant roles in how your body handles fat.
Okay.
Medical weight loss actually acknowledges this complexity through those detailed health assessments we talked about. They dig into things like hormone balance, whether there's insulin resistance, how your blood sugar is controlled, to get a much deeper, more nuanced picture of what's really going on inside your body.
So the idea is to work with your body's systems rather than just trying to fight against them with extreme restriction.
Precisely. It's about understanding your body's unique needs first, and then creating a plan that aligns with your individual physiology.
Makes sense.
And Stark MD also stressed how vital that psychological and behavioral support is.
For dealing with emotional eating and things?
Exactly. Addressing emotional eating patterns, developing real strategies for managing stress, building sustainable, healthy habits. It's about long-term management that goes way beyond just the physical act of eating.
This has been incredibly informative, really clarifying. So, as we start to wrap things up, what's the main takeaway you'd want our listeners to hold on to?
I think the most crucial thing to understand is that medical weight loss really offers this personalized, evidence-based, and medically supervised alternative.
An alternative to the fad diets.
Exactly. An alternative to the often ineffective, short-sighted, and ultimately unsustainable nature of those fad diets. It puts the priorities squarely on your overall health and your long-term success.
By getting at the root causes.
By thoroughly addressing those often complex underlying factors that contribute to weight gain in the first place.
And for you, our listener, if you've been trying to navigate this,
Yeah.
often confusing and frustrating world of weight loss, maybe feeling overwhelmed by all the conflicting info.
Which is easy to do.
So easy. We really hope this deep dive has brought some clarity, maybe some actionable insights for you. The goal was really to help you move beyond that cycle of quick fixes that just don't last, and towards a more informed, more empowered understanding of what truly leads to sustainable, meaningful weight management.
Yeah, and that leads to, I think, a really important question for you to maybe mull over.
Okay.
What potential could be unlocked for your long-term health, your well-being? If you shifted your focus away from just following the latest generic diet trend and instead focused on truly understanding and addressing your own unique health profile, what specific questions does all this information raise for you as you think about your own personal journey towards better health?